Cervical cancer is a type of cancer that develops in the cells of the cervix, the low part of the uterus connecting to the vagina. The vast majority of cervical cancers are caused by persistent infections with certain types of human papillomavirus, HPV. There are different types of cervical cancer, classified based on the type of cells involved. The two main types are squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma. Description: Squamous cell carcinoma is the most common type of cervical cancer, accounting for about 70 to 90% of cases. It originates in the squamous epithelial cells lining the cervix. Risk factors: persistent infection with high-risk HPV, especially types 16 and 18, is a major risk factor for the development of squamous cell carcinoma. Location: this type of cancer usually arises in the flat, thin cells on the surface of the cervix. Adenocarcinoma. Description: adenocarcinoma accounts for approximately 10 to 30% of cervical cancer cases. It begins in the glandular cells that produce mucus in the endocervix. Risk factors: adenocarcinoma is also associated with HPV infection, particularly types 16 and 18. It is more difficult to detect in its early stages than squamous cell carcinoma. Location: adenocarcinoma typically starts in the glandular cells of the cervical canal. Adenosquamous Carcinoma. Description: Adenosquamous Carcinoma is a less common subtype, representing about 5 to 10% of cervical cancers. It is a combination of both squamous and glandular cell types. Risk factors: similar to the other types, HPV infection is a primary risk factor. Location: Adenosquamous carcinoma affects both the squamous and glandular cells of the cervix. Small cell carcinoma. Description: small cell carcinoma is a rare and aggressive form of cervical cancer, comprising only about 1 to 3% of cases. It is characterized by small, round cells. Risk factors: this type is also linked to HPV infection. Location: small cell carcinoma can occur in various parts of the cervix. Neuroendocrine tumors. Description: neuroendocrine tumors of the cervix are rare and can include various subtypes, such as carcinoid tumors and large cell neuroendocrine carcinoma. Risk factors: HPV infection may play a role in the development of these tumors. Location: these tumors originate from neuroendocrine cells in the cervix. Early detection through regular Pap smears and HPV testing, as well as vaccination against high-risk HPV types, is crucial for the prevention and early intervention of cervical cancer. Treatment options depend on the type and stage of cervical cancer and may include surgery, radiation therapy, chemotherapy, or a combination of these approaches.